Dr. Osterberg, tell us a little bit about what sciatic pain, really means, where it comes from, and what methods are there to treat it, if any.
That is a great question. The sciatic nerve comes out of a couple different nerves in your lower back. It runs down underneath your gluteal muscles or your buttocks. It wraps around the hip and the back and side of the leg and goes all the way down to your foot. And when you have a problem with the sciatic nerve, you can have pain anywhere along that path all the way down to your foot. There's a couple different things that can cause sciatic pain. Just because pain goes down the leg doesn't mean it has the same cause. It can be coming from the spine itself, from some degeneration or some arthritis in the spine, or bone spurs can irritate it. It could be a more serious condition like a ruptured disc in the lower back or a bulging disc that's irritating the nerve. Sometimes it's just from inflammation, or it can also be pinched down in the butt cheeks by a muscle called a piriformis muscle that can affect that. So we can't necessarily treat everybody the same who has pain down the leg, but there are treatments for all those conditions. In our office, typically we'll use some manipulation, we'll use stretching exercises, we have some very effective therapies, including traction, some electric therapies that we use on that, and we tend to get very good results with acute back pain and leg pain. About 89% success rates right now in our office. But for those patients who don't respond well, for that other 11%, the next step would be oral steroid medication or possibly an injection in the lower back called an epidural injection. And we try all of those things before we recommend considering surgery for sciatic pain.
So those injections, are they done by a chiropractor like you, or does the person have to go somewhere else for that?
No, we refer patients out for that. Yeah, we have a couple of just really fine doctors here in York County that help us out with that.
Okay, all right. So on the treatment, let's just say that without surgery and without injection, on an average, does a person have to be in treatment forever from then on, or is that something, after a few 4, 5, 10 treatments it's done and he can rest safely? What's the deal there?
With low back pain and sciatica, the average is 11 visits in our practice. So usually we see some improvement within a 2-week period. Very quickly, within 4 to 6 sessions, we're seeing some improvement. And by the time a month has gone by, that patient's just about as good as they're going to be.
Wow. And is there anything a patient could possibly do to, so to say, prevent it? You understand what I'm saying? You can prevent, let's say, ingrown toenail by cutting your toe correctly and doing certain things. You can most likely prevent it. You can prevent teeth from falling out by doing certain things. Is there something a patient can do, or is it just, look, when it happens, and there's really nothing you can prevent?
That's a really good question. Yes, certainly a lot of back conditions can be prevented. Now, some of them come from trauma. If you fall down the stairs, there's nothing you can do to prevent that injury, or if it comes from a car accident, there's nothing you can really do to prevent it other than don't have the accident. But most of the conditions we treat don't come from trauma. It's something that develops slowly and comes on over time. And there's a lot of things that are related to high risk for back problems and disc problems and leg pain. Being overweight is one, having poor posture is another, performing repetitive motions on the job. For example, somebody who's a bricklayer, they do heavy lifting and bending all the time. They're always working down around knee height where they're bending and lifting and bending all the time. They're going to be much more likely to have problems. But in general, having good posture, staying active, staying fit, not being overweight is the best thing that you can do.
Okay. Because most of us don't know I suppose we do know what good posture is, but at the same token, we don't necessarily know how to get it. In fact, my mom, when I was 16, 18, 19, like shortly before I kind of moved out and away, and my mom would come up behind me and she would hit me between my shoulder blades and say, walk straight. I'm not so sure it worked because, I do have a tendency of being a little slouched, except when I buy a new suit, then I'm a good guy.
Then you stand up, yeah.
Yeah, then I'm really great. So, but anyway, is there something, people can do that they can go to people like you or to exercise experts who just, in so many things in life, we do get advice. We go to people who kind of tell us and correct us, and keep putting us back on the right road. Just like, for instance, my wife does with vitamin. I'm the lazy guy. I would, after 2-3 months without her, I would be off vitamins, despite the fact that I thoroughly believe in it, and I've seen the good results. Is there some suggestion you can make which keep a person balanced? A good coach. Where should people go for those things?
You know what? People who are more physically fit tend to have better posture. So certainly I recommend that people exercise on a regular basis. And we have a lot of good gyms and fitness centers here in York County. But posture is also something we do in our office. I mean, I don't know if I've ever treated somebody for a bad back that I haven't had to address their posture and give them exercises and help teach them to improve their posture. So certainly at times we have patients who will come into the office and say, I don't have any injury, I don't have any pain, but I know my posture's terrible and I don't want to get bad like my parents were, so can you help me with that? And we're happy to do that. So yeah, that's a service we provide. But in general, physical fitness improves posture all on its own.
Wow. So you're saying that even, let's say, a grown person, 40 years, whatever, who has, I'm not saying super terrible posture due to, being born or so, but a person who has, is a little slouchy, a little this, a little that, you really think that it's not so grown in that he cannot change, he can actually improve posture even at that age?
Absolutely. Very few people have reached the point that they can't improve their posture. Now, the most common posture problem in humans is called an upper cross syndrome. It doesn't apply to everybody, but 9 out of 10 people who have bad posture, it's because they allow their shoulders to slump forward, they allow their head to go forward, and they develop what's called an upper cross syndrome. And there's even a lot of information on the internet. You can Google upper cross syndrome and take a look, and it'll teach you some stretches and teach you some strengthening exercises that can be really good for that.
Wonderful. Well, as always, Dr. Osterberg, very informative. Thank you very much.
Thank you.